We are still just in the first 48 hours of the vaccine being a reality in Colorado, and we know there are so many questions. Who can get it? When? Where do you get it? What say if you have allergies?
That's why tonight I moderated a special Denver7 Town Hall, joined by a panel of medical experts, including Governor Polis. Denver7's Gary Brode has a look back at the top 7 questions and the answers you should know.
From distribution to transmission and everything in between, we're covering 7 questions you wanted answered in Denver7's Vaccine Town Hall. And it's a question that came up more often than most. When is it my turn, and who will let me know when I'm eligible? The executive director of the Colorado Department of Public Health and Environment, Jill Hunsker-Ryan, says some of the public could start getting the shots as early as March. Until then, stay in touch with your doctor to make sure you know when it's your turn. And as for where to get it when the time comes,
people will be able to get a COVID-19 vaccine pretty much where they get their flu shot. So from their primary health care provider, from a clinic, their local public health agency, or pharmacies like Walgreens and CVS.
Well, what if you have severe allergies to things like peanuts, penicillin, or if you have other medical issues? Dr. Richard Zane at UC Health breaks it down simply for those concerned whether they should get it.
Patients under the age of 16 currently should not get the vaccine. And other than the allergic reaction to vaccines, there's really no one who should not be getting this vaccine.
Dr. Zane says getting the vaccine doesn't guarantee you won't give the virus to others, and that's why he says it's important to keep wearing a mask and social distance until we know more.
We don't know if you are protected from spreading the virus. We have to wait until there's a significant amount of herd immunity and enough of the population has become vaccinated and immune before we think about lessening those protections.
You do have to get both doses of the same vaccine, which means it'll take about a month for the 95% efficacy rate to take shape. But that still leaves the question, if I get the vaccine, can I still get COVID-19? Dr. Zane says yes.
If you contract COVID after having been vaccinated, it is much more likely to be a milder form than it otherwise would have been had you not been vaccinated.
So how long should you expect the vaccine to last? Well, Chief Medical Officer for the Colorado Department of Public Health and Environment, Dr. Eric France, says only time will tell.
Ask me again in 6 months. We'll be gathering more information to understand how well this vaccine creates long-lasting immunity from COVID disease.
And Dr. France also brought up a question we received. Will the vaccine have an impact on breastfeeding mothers?
Currently, the CDC recommends that pregnant women, lactating nursing women should all be vaccinated. Have the conversation with their providers.
And what about fertility?
I too have heard rumors about questions about fertility with this vaccine and having some impact. I'm not sure where they've come from. Certainly there's no reason to think that would be a risk or an issue based on the science to date.
Gary Brode, Denver7.
And you can count on us to continue pressing health leaders to get your questions answered. In the meantime, you can watch the full 30-minute town hall right now on our website, on Facebook, and on your streaming device of choice.